Good afternoon, everybody, and welcome to our media question and answer time about COVID-19. Again, we're thankful that you are joining us and that others are joining us online to learn more about what's happening with COVID-19 in the Eau Claire area, and for media to ask some questions. We'll use our usual format. I'll walk through some basic data. There will be time at the end for questions that media has, and Audrey will help with me seeing those questions in the chat box. And then certainly if you'd like, you can unmute at the end as well. So again, thanks for joining us. It's February 4th, and we're happy to be here to share with you some encouraging news about our data and also some basic information about what's happening. So Eau Claire data, we are now at 10,672 individuals in Eau Claire County that have tested positive for COVID-19. 197, 197 cases since last week when we were here talking to you last. Our average number of cases is around 28 cases a day for the past 7 days, which is good news. And so that is the positive I will bring to you is that we are getting to a much more comfortable place with our case numbers. Still not at that 10 case a day amount that is really the expected standard at a state and national level for a community our size, but we're in a much better place than a couple of months ago, and I do want to note that. Our active cases are at 291 individuals that right now are positive and are home being isolated so that they don't spread COVID-19 to others. Those 291 people and their close contacts are how we slow down the spread of COVID-19 by not having it go out to the next circle. Ever hospitalized is now at 340 individuals. 5 new people this week were hospitalized with COVID-19 that are Eau Claire County residents. And we now have 98 of our Eau Claire County friends, family, neighbors that have died related to COVID-19, an increase of 1 since last week, Thursday. Other quick data points that we usually share with you at this once a week briefing include our jail testing is now at 418 people have been tested for COVID-19 at the jail, with a continuing 26 that have tested positive. Our UW Eau Claire data continues to really be a steady about 13% of the cases overall in our overall case numbers are connected to UW Eau Claire. A reminder again that UW Eau Claire is doing very extensive testing of students, faculty, and staff through a testing protocol that they have on campus. And it really is one of the ways that they're leaning in to help keep our community safer. Public health investigations, we are now at 37 active public health investigations in Eau Claire County. Again, a reminder that those are places where we have either 2 or more individuals connected at a facility, or if it's a long-term care facility, 1 person at that long-term care facility. We work with those to really, again, slow down the spread of disease at any entity where there may be positive cases happening. Our state rating for COVID-19 remains at that very high level. Very high, again, is if we have more than 360 cases in the past 2 weeks. We have had 460 cases in that 2-week period, in that 14 days. Our goal continues to be less than 150 in 2 weeks. So as I shared with you earlier, we are over that even in a 1-week period, so we have a bit to go. Again, the more we can do to decrease the spread of COVID-19, the more likely we will get below those thresholds. Our positivity rate is now just under 10%, so that is also good news this week. We are slightly down, and the positivity rate really is a measure of whether we're getting enough testing happening, and we're still needing more testing. We'd like that positivity rate to be well below 5%. And it gives us an idea of spread in the community. So again, much better than the 14% or higher that we were seeing. Testing data, we are now at 448 tests a day as part of our measures that we are looking at weekly. Again, please seek testing. If you have any symptoms, if you have been in close contact with anybody that has been COVID positive, if there's any reason that you think you need a test, please take advantage of the really well available testing options that we have in Eau Claire County. 7 days a week, you can get tested here. You can also order an online testing kit and have that available at your home to do with the Vault testing strategy. So please take advantage of that. If you go to our COVID-19 Eau Claire website, there is a testing page, and all of the information about the testing locations in Eau Claire County is at that page. A reminder that the community antigen testing site that UW Eau Claire has been working on for the last number of months is again available in Eau Claire County. It is at Zorn Arena on the Eau Claire campus rather than at the Memorial High School site, but testing for community members that are asymptomatic, have no symptoms, and need to get tested. Please do consider using the antigen testing site at Zorn Arena on the UW Eau Claire campus. Again, that information is available on our website. Other measures that we report on weekly include capacity measures. So our regional hospital bed space has been in the green for a bit, and that is good news. And unfortunately, our ICU bed right now is in the red. So we're watching, again, that carefully. We want to make sure that hospital capacity is in a place where people that need care for any reason are able to get it. Right now, that is true in Eau Claire, but we don't want it to go in the wrong direction. So we watch that measure carefully. Community spread is at 39%. That remains in the red. Our case contacts, how quickly we get to the individuals that are COVID positive and the percent that we get to in the first 24 hours is a measure that we track. And we are now at 87% of people get a phone call within that first 24 hours where we can talk with them and make sure that they are staying home and not spreading COVID-19 to others. Please go to our link on our webpage. We have lots of data there. If you look at the data page, in that page are all of the measures that I talk about every week, and we really do show you a red, yellow, green measurement there to give you some sense of what's happening in the community on a weekly basis. A couple of state data points for you. We are now at 546,955 positive tests for COVID-19. Those are individuals across the state, an increase of 8,600 since last week, Thursday. We do have more than 16,500 active cases being worked with across the state by health departments like ours, and the state activity level remains very high. Again, we are looking forward to that measure, the very high measure, going down so that we see more controlled COVID-19 in our communities. Our death count now at a state level is 5,992 individuals, Wisconsin residents, family, friends, neighbors that have died from COVID-19, an increase of 181 people since last week, Thursday. We're almost at that 6,000 individual mark in the state. A couple of quick updates in addition to the data that I just shared. A little bit about face covering requirements in the state and the city and county. On Tuesday of this week, city and county ordinance, so the City of Eau Claire and Eau Claire County Board did pass local face covering ordinances. Those were ordinances that were all but identical with some formatting differences because of them being city versus county ordinances. Those ordinances, when in effect, will cover the entire jurisdiction of Eau Claire County. They are the same language and the same provisions that are in the state order that we've had for a number of months now. The only addition to our local ordinance or the local requirement is the requirement for public entities, public-facing entities that'll have people come into their spaces to post a sign on their door indicating that face mask use, face covering use is required. That ordinance that was passed at a local level, the city and county level, is in place if there is not a state order. It is also in place once it gets published in our local newspapers, which is in process of happening now. Today, the joint resolution by the Senate and Assembly was signed and did get moved forward, which did strike down the governor's order, the emergency declaration and face covering order. That happened this afternoon. Pretty immediately following that striking down of the existing governor's order and the emergency declaration and order, the governor did release a new order. So there is a new emergency declaration in place, a new order for face coverings at the state level that happened, I think, less than an hour ago. That order and emergency declaration and order are in place right now. So even if our local ordinance was published, which it's still in process of being published, it wouldn't need to be in place. That is only going to be in place if we do not have a state order for face mask use. We'll be following that. We know it can be confusing as things happen at the state level, but we'll make sure people have clear and understandable information about what currently is happening in Eau Claire County. I also want to say that this should, for all of us, not be about what do we have to do, what are we required to do. We really need to be a community where we are talking about what do we need to do for each other? What do we want to do for each other? How do we lean in for each other to keep each other safer? Using a face mask, using a face covering when we're out in public is about doing something for one another. So I really challenge everyone and encourage everyone, despite the tough conversations that have been had over the last week, to really lean in and challenge yourself and challenge those around you to find ways to say, we're doing this not because we have to, we're doing it because we want to, because we need to, because our community, our kids in schools, our businesses, our people that work in businesses that are interacting with us every day, they deserve us wearing face coverings when we're out. So I encourage everybody to look at it that way, and we'll keep you informed about next steps. I also will tell you that we continue to work every day in our health department and across Incident Command to support businesses, support entities in really moving forward successfully with the basic mitigation strategies like using a face covering that are critically important for our community. We'll keep doing that. We also will be available if people have concerns about entities that aren't following basic mitigation strategies. And we will talk and walk through with those entities why it's so important for all of us to be doing that. If you have questions or concerns, you can always call our COVID hotline. Our number again is 715-831-7425. And certainly let us know about significant concerns you have where disease spread might be happening in our community. I'll also share that vaccine continues to be a critically important topic. It's where most of us at the health department are spending the majority of our time. We all are focused on making sure that we can get vaccine into Eau Claire County and get it into arms as efficiently as and effectively as possible. We continue to work with all the vaccine providers in Eau Claire County. There are a number of them. They're healthcare entities, the health department being the places where we have primary vaccine access right now. Again, if you go to our website, we have a page where you can quickly and easily see the resources that are available. I would remind everybody that our biggest challenge still is that we don't have much vaccine coming into the state, and therefore not enough vaccine coming into Eau Claire County for all of the eligible populations. We've shared this previously, but the state gets about 70,000 doses a week coming into Wisconsin. And again, when you divide that up by the number of people that are eligible across the state, you can quickly understand why we aren't getting enough vaccine here to cover all of our eligible people in Eau Claire County. All of our partners and the health department are working hard to get appointments out with every dose of vaccine we get in and vaccinating people quickly. Health department clinics are continuing on Wednesdays, and we are meeting those eligible populations just like the other providers are doing. This week, as well as coming up next week, we are not getting as many doses as we are all requesting. So we will have, unfortunately, fewer appointments available than what we actually could be providing. So please have patience. No, we will get appointments out as we have vaccine available. Know that we also expect everybody to continue to use those basic strategies, even with vaccine starting in our community and getting vaccine in arms. We still need to wear face masks. We still need to use distance. We still need to stay home if we have symptoms and are not feeling well. As of yesterday, we have all of the vaccine providers across Eau Claire County and across the state have given 14,298 doses of vaccine to Eau Claire County residents. So that's good. We are getting vaccine in arms, and it's really a critically important task that we all have right now. We are making plans to open a vaccine clinic in Augusta in the next couple of weeks. We are doing that so that we are sure that people that may have difficulty accessing locations in Eau Claire are able to get vaccinated as well, especially that 65-year-old and older population that's currently eligible, and others that are eligible in the 1A group, our healthcare worker group, that may not have gotten vaccinated yet. We are also working with all of the individuals and entities that are eligible in the next round of vaccines. So we're ready for that. Do know that if you are part of an organization or business, that we are reaching out to businesses now, entities now, to make sure that we have good contact information, that we're providing resources, and we're making sure that those entities know how to link to vaccine resources when their population, when their employees are eligible. The next group we're anticipating will be schools, and we are working with them regularly to make sure plans are all in place and we're ready to go when we have vaccine in Eau Claire County. If you're not connected to the Chippewa Valley Economic Recovery Task Force and you are connected to a business in Eau Claire, please look online to get connected to that resource. Our Chippewa Valley Economic Recovery Task Force has been, since the start of the pandemic, a place where we are reaching out to businesses through all kinds of means to make sure that they know how to not only stay on top of the mitigation strategies that they need to be doing, but also now that we are going to be having vaccine available, making sure that they understand what the best things they can be doing right now to prepare for vaccine coming and to get their employees ready for vaccination. So please link on our website if you have not done that already. If you have questions about that, you can also reach out to our COVID-19 hotline. But that website has a lot of good information. You can link to resources there, and you can get connected so that you get right up front information sent to you about how vaccine will roll out for your specific sector or business. If you're eligible for vaccine right now, again, go to the vaccine appointment tab on our website. That's a one-stop button. Click on that and you will quickly get routed to resources in this community to get your vaccine appointment. Again, be patient. Know that there are only limited appointments now, but we will get people through as soon as we get vaccine. We know some people do not have computer access. We also know some people don't easily connect to resources that are available on a computer. Reach out if you know someone that is struggling, that is eligible. Let us know if they need to be connected by phone to someone to get them linked to an appointment. There is support through the Aging and Disability Resource Center. There's support through the health department to make sure that we have people connected to vaccine when they are eligible. So with that, I will move to questions that we got in advance from the media. And then following that, I'll ask Audrey to sort through any questions that came in via the chat box. So first, when will the local mask order take effect if the state order is voted down? I did address that earlier, but again, the state order that was in existence yesterday and this morning was struck down by the joint resolution of the Assembly and Senate. It was quickly reinstated by the governor not long after it was struck down. Our local ordinances at the city and county level will only be in place if we do not have a state order for face covering. Again, we're in process of getting the ordinances published, and they will be then published and ready to go if there is any change at the state level. Another question came through about vaccine appointment cancellations due to weather. How can folks find out about any new openings as well? Do providers reach out? How do people know if they can get an appointment, how to get an appointment, and what to do about their appointment if there are problems? Our healthcare entities have specific processes, and we really are asking people that if they've made an appointment and need to reschedule an appointment, that they go to the link where they made that appointment. So if it's a healthcare entity, go to that entity's link on our website and really follow the path. Usually it's a phone call to that entity to change their appointments. Some of our healthcare entities and others are looking at weather and making adjustments. You'll be notified in a variety of ways if there are changes. If we hear about anything, we'll also make sure that that's widely available on our website. Vaccinations are by appointment only. Please do not show up at any of the locations hoping that you'll get a vaccine. We are really working hard to try and avoid big lines and big backlogs where people are struggling to get vaccinated. We want to do it in a way that quickly gets people through, and the quickest way we can do that is through a simple appointment schedule. So again, please honor that and use that to get through. We do have, like the health department has, a standby or a wait list so that we may be able to fit some people in at the end of a clinic if we've had people either not show up or cancel at the last minute. And we will get additional people through with that standby list. So there are, for example, in our schedule every week, you may notice that there are standby appointments, and please sign up for those if you are someone that is still waiting to get an appointment and you see those on our list. Again, check with your providers online to look for appointments. Those numbers and those links are all on our webpage. Please make sure that this weekend particularly and tomorrow that you travel safely. I know that the weather is not good and we want people to be safe, whether they're heading out for a vaccination or heading out for a COVID-19 test. We want you to stay safe in that process. So with that, Audrey, do we have any additional questions?
Yeah, Lisa, there's two questions. The first one is whether or not you have a comment on the Wisconsin legislature's move to repeal the state mask mandate. And in your opinion, would repealing the statewide mandate likely mean more virus spread?
Yeah, thanks for that question. So this is really related to our discussion earlier about the local and state requirements for mask use. Face mask use is a clearly proven strategy and clearly proven if we do it at a community level. Large decreases in our COVID-19 numbers will happen if we have full use of our face mask mitigation strategy. The more people that mask, the more likely it is that our rates of COVID-19 will go down. That's well seen in the research across many, many communities in the US, including at a state level. I really see that we should have a state mandate for this or a national mandate for this. COVID-19 does not stop at the Eau Claire County borders. There are other communities that are looking at local orders and local ordinances with the concern that there may not be a state order, but this is really best done at a state level. Again, it's not about what we have to do, whether we have to do it in Eau Claire or we have to do it in the state as a whole. We should be doing this because we care about one another. We want to do this because we care about one another. And that's really how we all need to lean in about it. It shouldn't be political. It shouldn't be about striking down a governor's order or a legislative order if it was done at that level. It really should be about what we care about together in order to slow disease spread down. It will make a difference if we get a high percentage of our population all using face masks to slow the spread of disease. It's imperfect, but it's much better than if we don't use them.
The second question is about hospitalizations, and considering that Eau Claire is a hospital hub for the region, would the lack of a statewide mask mandate impact case counts and hospital capacity in Eau Claire?
So hospital capacity is one of those measures that we do track in our measures, and we care a lot about in Eau Claire, particularly because we are a regional hub. When our case numbers went up drastically, we all saw that the hospitals really struggled with the volume of people coming into their doors, not just Eau Claire County residents, but people from across the region, and really in a wide swath of people coming into Eau Claire. Absolutely, if case numbers go up, and case numbers could go up if we don't follow basic mitigation strategies, we will have challenges in Eau Claire with our hospital capacity, and that's exactly what we're trying to avoid.
Those were all the questions in the chat box. Is anyone else online that would like to unmute and ask a question directly?
All right. Thank you again, everybody, for joining us. We appreciate your time. We appreciate your interest in learning about what's happening with COVID-19 in Eau Claire. I encourage all of you to find ways to really lean in to care about one another and show that. And I know many, many people in this community are absolutely doing that every day. So thank you to those of you that are finding the little and big ways to do that. I also encourage you to go to our COVID-19 website. Again, that's covid19eauclaire.org. And if you have questions beyond that, to call our call center. That's 715-831-7425. We'll be back next week on February 11th with updates and our updated data. Thank you very much, everyone.